guys, I hope you're having a good week. Happy Wednesday. I think is when this will go up. I'm obviously filming it in advance for you all. Today I'm going to be talking, as promised, all about the different types of cosmetic lasers, whether that be for dark spots, redness, dilated blood vessels, or sagging, wrinkled skin, anti-aging. You all have asked many questions about this topic, and it's one I've wanted to address on here. Last week I talked all about chemical peels, and the week before that on Wednesday I talked all about microdermabrasion. I've talked about how to exfoliate the face, so this is kind of a little throughout the week's series that I've been doing, just kind of focused on cosmetic procedures that you all asked me a fair amount about. So what exactly do lasers do anyway? Well, different types of lasers convert light energy into heat that is directed either into or on top of the skin to affect a desired change, whether that be targeting dark spots, redness, dilated blood vessels, spider veins, or targeting deeper layers in the skin to boost collagen production, to give an anti-aging effect, if you will, and improve the appearance of wrinkles and textural changes, as well as scars. Hopefully the content in this video will be of help to you in terms of if you are going for a consultation visit for a laser procedure, you can ask some more specifics about the details of the laser that will be used on you. So there are actually, quite a variety of different lasers. Fractionated laser is the laser that works most deeply in the skin and is the one that is most useful for targeting skin concerns such as wrinkles and scars and kind of resurfacing the skin, textural changes. It's probably one of the more, quote, aggressive laser procedures. Intense pulse light, or IPL, however, is far less, quote, intense than fractionated laser. But what IPL, or intense pulse light therapy, works well for is discoloration and the redness associated with rosacea. Then the other type of laser that you should be aware of is one called a Q-switch laser. Q-switch lasers are a kind of a separate category and each have their own specific wavelengths, but overall Q-switch lasers are the lasers that are most helpful in targeting pigment as well as tattoos, okay? So they are helpful in getting, those are what are most likely going to be used to target your tattoo, if you want a tattoo removed. And then another popular device in kind of the category of laser is a radio frequency device, although not technically a laser. These kind of work to firm the skin by heating the skin deeply, and they can kind of have a subtle tightening effect. People find people who pursue this type of treatment usually are looking for improvement in saggy skin or kind of the sort of saggy wrinkles. It can help rejuvenate the neck, for example. But one thing I want to underscore is that laser therapy, lasers and the science behind lasers, it is a science, okay? And dermatologists are very well trained in that science and how to target different wavelengths to different components of the skin while minimizing risks of side effects, okay? The way lasers work is they convert light energy into heat and deliver it to the skin to target specific components, all right? And so selecting the most appropriate wavelength is very important to target these things. Otherwise, you can have unnecessary heating of the surrounding tissue, and that can result in disfiguring hyperpigmentation. So it's very important that you make sure you choose somebody who is well experienced and well trained, okay? I'll say that from the get-go. Laser therapy is the type of procedure, however, that you really want to research the credentials of the individual performing the procedure. Ask if they are a board-certified dermatologist, and ask if they have done any specialty fellowship training after their dermatology training, such as in a procedural fellowship or a cosmetic fellowship. This can be very important. Ask to see their credentials when you go for the consultation. There are many people out there who have lasers and purchase a laser. They may be a physician but don't have the right training as to how to use it properly, how to target certain pigments and that kind of thing. And so to minimize the risk to yourself, I would really do the research to make sure that the person is very well trained and knowledgeable as to what they're doing, because there are some risks associated with laser treatments depending on the type of laser. And so you don't want to just go to somebody who is, quote, pointing and shooting. That can be very dangerous and have scarring effects. In the past, resurfacing lasers were really aggressive, and we used one called the CO2 laser. There was also another one called the erbium YAG laser, and these physically broke through the epidermis, or the top layer of the skin, as well as the dermis. And in effect, it would create a controlled wound, and as that wound healed, deeper layers of the skin could kind of regenerate, and it can boost collagen production and matrix formation, and improve the appearance of scars as well as wrinkles. CO2 and YAG lasers are some of the most invasive types of lasers. But for the most part, for most cosmetic dermatologists, these lasers have been replaced by the fractionated laser. And a fractionated laser is really sophisticated in that rather than just kind of doing a seek and destroy emission of the entire skin, it creates little micro wounds in the skin, or microthermal damage zones, okay, little columns of wounds, and then the skin can regenerate through those columns and repair itself and boost the collagen production that way. It basically makes little mini holes in the skin, and it creates columns of wounds, and so the new healthy skin cells come up, fill in those columns, and the neighboring skin in between the little holes that the fractionated laser has created. But in general, as far as the different types of lasers, okay, the old school ablative CO2 or YAG lasers, who would have pursued those? People looking for anti-aging or skin resurfacing benefits. This is a radical resurfacing laser, very painful, and has a 3 to 4 month recovery period. Fractionated resurfacing lasers, however, are likewise pursued by people who are seeking collagen production boosting properties for anti-aging and scar rejuvenation. This procedure is painful, but is far less painful than the resurfacing lasers that I mentioned before, the CO2 laser and the YAG laser. And the downtime is anywhere from 2 to 7 days. Intense pulse light is something that people with the redness of rosacea might select, as well as kind of some redness, uneven texture, and overall sun-damaged skin. Something on the side of the neck that I've talked about in my videos called poikiloderma of Savant. That's kind of redness, dilated, tiny little blood vessels, brown spots, just overall discoloration and modeling of the skin on the side of the neck related to chronic sun exposure and photo damage. It's called poikiloderma of Savant. Intense pulse light therapy can be helpful in rejuvenating the appearance of that. And the recovery from intense pulse light is anywhere from 1 to 3 hours. I mean, it's pretty short. And it's a little painful, but not too bad. Then we have the pigment lasers, or the Q-switched Indy YAG lasers, that target specific dark spots, like maybe a sunspot on your face. They also target different tattoo inks for tattoo removal. And more specifically for brown spots, it's usually a laser called Indy YAG, ND YAG, whereas a laser that would be used to target dilated blood vessels, spider veins, telangiectasias on the face, that's usually called V-beam or Ruby. Then as far as the radio frequency devices, they go under the name of thermage, and they can be helpful for people who are seeking to tighten kind of saggy skin under the neck, or kind of jowls, if you will. And their downtime is usually about a day. Now, who should not do specific types of lasers? Let's get into that, because it's really important. If you're somebody who's susceptible to post-inflammatory hyperpigmentation, meaning you have a dark spot after a pimple goes away, and the dark spot stays there forever, this tends to affect ethnic skin of color. If that is you, you probably want to avoid intense pulse light, because it can make you very susceptible for more post-inflammatory hyperpigmentation. So it's generally not a good choice if that sounds like you. There's also the Indy YAG pigment targeting lasers are ones to be careful with if you are somebody who heals with post-inflammatory hyperpigmentation, as these too can cause that. There is an exception, however. There's certain kinds of birthmarks birthmarks on the face, discoloration on the face due to a birthmark called a nevus of Ota. Okay, it's kind of a discolored birthmark around the face, common in African American and Asian skin types. Certain Indie YAG lasers are indicated to help remove that if that's something that you're seeking. So how long does each laser therapy take? Well, fractionated laser takes about anywhere from 10 to 40 minutes depending on the extent of the surface area that's being treated. Plus you should be prepared for about 1 hour of wearing some numbing medicine and then post-procedural care that the treating physician will go over with you or the nursing staff will go over with you. The pigment targeting lasers like the Indie YAG targeting sunspots and those can take a few minutes because they really are just zapping the spot. If you're getting a big tattoo, however, that can take quite a while depending on how big the tattoo is, and that often requires multiple visits. Intense pulse light therapy is usually 20 minutes. Probably one of the longest procedures, however, is the radio frequency device. That can take up to an hour. As far as the pain level with each laser, however, the fractionated laser is kind of painful. Interestingly, though, many people are surprisingly comfortable throughout the procedure and don't really complain of much discomfort. The pigment lasers that are going to target like sunspots, for example, those are kind of going to feel like a hot snap, like a rubber band that's like a hot rubber band snapping you. That's kind of what it feels like. The intense pulse light therapy has a cooling device on it, and so it actually feels cold going on the skin. And it can be a little painful, but the person administering the intense pulse light can turn up or down the energy that's being delivered so as to adjust to the pain comfort. So, give some verbal feedback if you're getting this procedure. Ow, that hurts. Usually, then nobody wants to cause pain. Plus with the numbing medicine, most people don't have any discomfort with the intense pulse light therapy. Radio frequency or thermage is actually kind of painful. It sort of feels like a hot poker, I've been told. So as far as downtime and recovery, for the fractionated laser, the skin usually looks kind of red and puffy and swollen for around 36 hours, so a little over a full day after the procedure. Sometimes people with really sensitive skin can benefit from just taking a little over-the-counter antihistamine to help with some of the swelling and redness. Then after that kind of dies down, your skin sort of has a kind of bronzed brown appearance for a little while. And do know that during this time period, the skin has essentially been wounded, so it's kind of recovering, and you can have you look a little worse for wear, and you may get some strange looks. The reason the skin, the reason the skin looks brown is that there are teeny tiny pinholes that have been made throughout the skin. You can't see them with your eyes, and people can't see them. But as the new skin is coming in and filling those little tiny micro holes, the old skin's kind of crusting off and sloughing off, and it kind of gives a brownish appearance to the skin. If you have a brown spot or a dark spot targeted by one of the pigment lasers, it's going to look kind of vicious for a few days before it starts to look better. Sometimes there may be a little bruise associated with it, and it'll be very red, and then it'll kind of scab up, slough off, and go away, is the hope. With the intense pulse light, you're usually a pink to a little red for 2 to 3 hours. Up to a week, however, after the procedure, your skin can look a little bronzed, but that has to do with just some of the blood vessels in the skin. They leak out something called hemosiderin and kind of give you a bronzed appearance, but that goes away. And then with the radio frequency device, there's pain and swelling. There's a little bit of pain and swelling, but for the most part, people walk away from that and you can't really tell that you had anything done as far as side effects. I think the most important thing for you to understand if you're getting one of these procedures, however, is that they do basically create a wound in the skin. And so after the procedure, it's really important that you use a thick moisturizing cream to keep the skin moisturized, because the skin barrier is markedly impaired and is going to become quite dry and parched and flaky. It's also very susceptible to sun damage and post-inflammatory hyperpigmentation. So you really want to avoid the sun for at least a week and definitely be very militant about sun protection. So this is not something to do and then skip off on a cruise. You won't be too happy with yourself in that case, because you can get a really bad sunburn and have worsening of post-inflammatory hyperpigmentation. So avoid the sun for sure for at least a week, and be very, very diligent about sun protection. I can list some of my favorite moisturizers that are good in this setting, as well as sunscreens and sun protection. But avoid any fancy creams, avoid any creams that have fragrance in them, avoid things that, claim to have all of these ingredients in them that can benefit skin health, unless you have been given a cream by the treating physician that they want you to use, in which case that's their decision. But don't run out to the store and buy some like $600 cream, because 9 times out of 10 that's going to be problematic and not helpful whatsoever, plus drain your wallet. So avoid any kind of fancy high-end cosmetic-y cream with a bunch of fragrance and nonsense ingredients in it. Just stay away from those. As far as when you can expect to see results, however, with the fractionated laser, you may actually see some improvement as early as 7 days after the procedure. But do you know that depending on the nature of your skin concern, so for example, if you've got pretty significant scarring from acne, then you may need several treatments, like 4 to 5, for example, to really see maximal benefit. And the pigment laser, you can start to see effects anywhere from 3 to 10 days. It really depends on the skin lesion that was treated, and the where on the body it was. Things on the face tend to heal a little bit faster than things like on the leg, for example. If you've got some sunspots on the leg, those might take quite a bit longer to see the improvement. Intense pulse light therapy usually takes several treatments, and usually after the second or third treatment is really when you may start to see an overall smooth improvement in smoothness of the skin, and skin redness is improved. The nice thing about laser treatment, however, is that the results are forever, so long as you continue to take good care of your skin and protect it from the sun. So this isn't something that you have to maintain is long lasting, so long as you keep up with the sunscreen and sun protection. And then how many treatments can you expect to have with each of the lasers? With fractionated laser, honestly, it's usually about 4 to 5 treatments that you can plan on having. The pigment laser for sunspots, for example, or dark spots on the face, that can usually be done in just one zap, one treatment. But sometimes, it may come back a little bit, in which case a second treatment may be indicated. But for the most part, it's usually just one treatment. Intense pulse light is the one that is actually least intense as far as destroying the skin or making you feel like, making you look red and raw, but it's most intense as far as your time. Usually requires anywhere from 5, sometimes up to 12 treatments, depending on the extent of the skin concern. But because the downtime is so minimal with IPL, you can do it on a weekly basis. With radio frequency, that usually you need 1 to 3 treatments, because it has a cumulative building effect for skin tightening. And then lastly, I get many questions about the at-home lasers, if I can talk about those. At-home light devices, wands, are those effective? Do they work? Their outputs, as far as the energy that they put out, are incredibly variable. So sometimes, you may pay a lot of money for nothing but a glorified flashlight. So I don't recommend wasting a dime on any of those devices. So yes, going to a dermatologist and paying for laser treatment is expensive, but it's like a car is expensive, right? But you know that it should drive, okay? You can buy a picture of a car, but it's not going to take you anywhere. It may be less expensive, but you're not going to get to the destination. So don't waste your money on those devices that they sell in the store. Honestly, they're just gimmicky, and who knows? I mean, it could basically be a glorified flashlight. Some people will say they used one and found it beneficial, and that's fantastic. Please share in the comments below. But like I said, I really can't comment on which ones are good or not, because they're so variable that I have no way of ever knowing that. And one more thing that I will say about seeing a dermatologist for evaluation and management, and why I think it's an important step, is that there are certain skin lesions that you may think are a sunspot or a dilated blood vessel or a telangiectasia that are in fact not something benign. They are something more concerning, such as either a non-melanoma skin cancer or a melanoma, God forbid. So I strongly advocate that you guys see a dermatologist for evaluation and management of the particular skin concern, because you may think that, oh, this is just related to age or some, you know, just dilated blood vessel that I just have and I want to get rid of it. Well, it may actually be something more medical that requires actual treatment, okay? So my point is this, is that if you sell yourself short on that evaluation, you really put yourself at risk if you go to, say, a spa and have someone just point and shoot the laser at what could be a melanoma. This does happen and is very dangerous, okay? So better to be safe than sorry, and go to somebody who knows what they're targeting and has the appropriate knowledge to say, hey, this is not a sunspot. This is a concerning lesion. It needs a biopsy. It needs further evaluation rather than just destroying it, okay? Because if you have a procedure performed on a lesion like a melanoma, for example, it can severely alter the distort the appearance of the skin lesion in such a manner that it's very difficult to render a diagnosis later. It's very difficult to determine the histology of the skin lesion. It can really screw things up as far as evaluation of that, and really put you at risk for a deadly skin cancer disease, really put you at risk for negative consequences. So I'm biased. I'm a dermatologist. It's not that I think that we're best at it. Plastic surgeons also are very good at this. But, when it comes to your health, you want to go to somebody who is a healthcare provider, honestly, and knows how to evaluate skin lesions. And that's a dermatologist. I mean, that's all we do all day, okay? That's what our training is in, is looking at moles and determining if they're safe or not, okay? And making judgments, making clinical decisions about them. So I advocate that over just buzzing in on a Groupon package to get your spider vein treated when your spider vein could be a basal cell carcinoma. Okay, so please don't sell yourself short on that. Anyways, guys, I hope this video was helpful to you all, and I hope you're enjoying some of my talks on cosmetic procedures that you all asked me about a fair amount about. So if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.